Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith. I'm a vestibular physical therapist, and I'm going to be answering the big question of how do you know if you have a vestibular neuritis? I'm going to give you 5 key signs that are going to give you a good indication that vestibular neuritis is what's causing your vertigo. Now, the first one is a sudden onset. Now, if you take a look at the vestibular system, you have those semicircular canals that's more associated with the BPPV, those little crystals getting loose. But a vestibular neuritis is where that nerve that carries information from the vestibular system to the brain gets affected. Now, usually it's affecting one side, and when that inflammation affects the nerve, that slows down the signal. And so you can think about it. If you're in a canoe and you have 2 people in there and one person's going a little bit faster than the other person, so that faster person is the one on the normal side, giving that normal input, and the other person that's going a little bit slower was affected by that inflammation and is going a little bit slower, sending a different signal. Now, if you have 2 different signals from each side, that's going to cause a discrepancy, causing dizziness. And that's what's happening when you get that sudden onset. One side's not sending the same signal as the other side, causing that dizziness. Now, in fact, there's a reflex between the inner ear and the eyes that helps keep your eyes on a target. And that is affected with vestibular neuritis. And so oftentimes what you'll see is that you'll see your eyes darting back and forth, and we call that nystagmus. And this is what often is associated with that room spinning sensation that people experience. And why they experience it is because the eyes are moving back and forth. Now, that sudden onset of vertigo happens with vestibular neuritis because of that inflammation in the inner ear, but you can also have a sudden onset with BPPV, right? So when you lay down with BPPV, those little crystals move, causing dizziness or vertigo, also causes nystagmus. But what are the key differences between the two? And that comes down to our second point of what is a key sign of vestibular neuritis is how long it lasts. So vestibular neuritis is going to last hours to days, whereas BPPV is going to last typically less than a minute. So BPPV, less than a minute, comes on with positional changes. Vestibular neuritis is going to last hours to days, and most often, vestibular neuritis is associated more with nausea and vomiting because of that persistent spinning and because of how long it lasts. Whereas, that BPV kind of goes away. People do have nausea and vomiting with it, but it's not as prevalent as vestibular neuritis. So first, sudden onset. Second, we have that episode of lasting hours to days before progressively improving. So you kind of have these 2 phases of vestibular neuritis. You have that acute phase where you have that spinning because of the nystagmus, and then eventually your brain compensates for that weakness on one side because the brain is awesome. And then you're just kind of left with no longer having that spinning sensation. But here's the third point is you're still left with balance issues. Now, you'll notice balance issues throughout the whole thing, even when it just starts. So often people say, like, I couldn't get out of bed because I couldn't walk. And the reason is, again, if you think of that canoe, again, one person's going a little bit faster than the other person, causing you to feel like you're falling off to one side. And so you'll notice probably that you're always falling off to one side in particular because you're getting a stronger input from one side and a weaker input from the other side. And so that's the third one, is that you'll notice that you're falling off to one side in particular. Now, the fourth sign is that you're going to have a lot of difficulty with your balance when your eyes are closed. And the reason is because we use our vision, our inner ear, which is the vestibular system, and your feet for your balance. And so if your inner ear is compromised, it's not giving you the same input as your vision and your feet are, your brain's going to default to your vision. And it's going to say, okay, well, I got to figure out what I can trust in order to keep myself upright and balanced. But the vision is easily fooled. When you're in a crowded area, you can just, it's difficult to find a focal point to fixate on to keep yourself steady. And especially when it's dimly lit and you can't use your vision for your balance, it's going to be really difficult when you take your vision away because you can't use your inner ear system, you can't use your vision. You're going to have a lot more trouble because you're only using your feet for your balance. And you'll notice, like in the shower, that you're swaying a lot or falling over with your eyes closed or having more trouble when you wake up in the middle of the night to go to the bathroom or something like that. It's dark. So that fourth one is difficulty with your balance, especially when your eyes are closed. Now the fifth one comes back to that reflex between the inner ear and the eyes. So remember I said that reflex keeps your eyes on a target when you move your head quickly, left and right. And now the inner ear is sending a signal to the eyes to go to the opposite direction of your head movement so that your eyes can stay on that target. But if you have one side that's weak, well, it's not going to do that great of a job, right? So again, that side's not going to be as responsive. And so when you turn your head quickly, you're going to experience what people typically experience, what they typically say happens is kind of the world has to catch up with them. And so people describe it differently, but dizziness with quick head turns is going to be that fifth big sign. So once that acute phase is over, you're going to notice a lot of balance issues, dizziness with quick head turns, and difficulty with balance when your eyes are closed. And particularly, you'll notice you're going to be falling off to one side in particular. And if you are having trouble with this, if you need guidance to get through this, and you want exercises and step-by-step guides on how to get through and recover quickly from a vestibular neuritis, check out my membership at vertigorecoverydr.com/membership. I'll put the link below. But I'm going to have guides to guide you through exactly what you need to do to recover from a vestibular neuritis as quickly as you can, and the exact and best exercises that you need to get through that phase. So those are the 5 key signs of vestibular neuritis. If you have any questions, please put them in the comments below. I hope this was helpful, and thank you for watching. If you want to continue getting content like this from me, then please hit that subscribe button, and it'll alert you whenever I post new content. But thank you for watching, and yeah.